Well, I think the biggest idea behind writing this series was to give family caregivers one consolidated place to turn. They're so inundated with information, they're so overloaded with caregiver burden, what they have to do, what they need to do, that they don't have time to go web surfing and to find various sites that could help them or give them information. Really, the idea behind all this was to give them one easy place to find the information they need, to give them some resources, and to let them know that they're not in this by themselves, that there are other caregivers out there experiencing what they're experiencing, and to learn from each other so that they don't have to reinvent the wheel and go through this on their own. There were a couple of real lessons that really hit home. One is that, particularly in the US, the system is not really designed to support the family caregiver. It is more of a treatment-based system than a well-being system. The supports and services are sometimes available, sometimes not, depending on the state and perhaps even the individual community that people live in. Medicare doesn't reimburse for the most basic of care unless there's skilled nursing involved. So, for example, if a family needs support with helping mom or dad get dressed in the morning, that often comes out of pocket. People are unprepared, people are overwhelmed, and people are really at a loss where to turn. The other thing that struck me was how complex our system is. There's multiple providers, multiple specialists, multiple sets of paperwork that have to be gone through. And there really is often nobody who's prepared to coordinate it all. It usually falls on the family caregiver to do this. And the problem with that is it's just one more thing they need to do. Things fall through the cracks, questions don't get asked, and often the people they go to don't really have the answers. So there's no real central clearinghouse for them to turn to. I think a lot of family caregivers are afraid to ask questions. They feel intimidated, perhaps, by the physicians, or the physicians are very rushed and they don't really spend enough time with the caregivers. So they're often left with being handed a brochure saying, here you go, and they're kind of thrown out into the world. Now mom or dad or my husband or wife has Alzheimer's, and they leave the office very confused and they don't know where to turn. That's a big pitfall. I think the other pitfall particularly is that caregivers don't know where to turn for support. They don't know where to turn for help. And they think, for a lot of them, think that they have to do this all themselves. They carry this burden, it's tremendous stress. They're often juggling a job or younger children in addition to caring for an aging parent. And they make phone calls, they don't get satisfactory answers. They're inundated with paperwork, with forms. All of a sudden, maybe they have to juggle finances that they weren't prepared to juggle. Most of the caregivers I spoke with, the overriding feeling was of being just so overwhelmed, and the stress levels are through the roof, and they don't know where to turn. And they don't know how to ask for help because they don't know what they need. I did find a few unexpected good things that came out of this. Many caregivers say that they've become much closer to their siblings throughout this because it becomes an entire family effort, particularly if they're caring for a parent who's living with them in their home. The siblings take on some of the burden so that there's greater communication. I spoke with one caregiver who said she speaks with her brother perhaps 2 or 3 times a day now, where in the past perhaps they spoke once a month, because they're both vested in the outcome, and they both are doing everything they can to help their father. So that was a nice thing, that in many instances, brought the siblings closer together. I think what was so remarkable to me, though, was the resilience of many of these caregivers. Their ability to maintain a positive attitude in spite of everything they have to go through, in spite of the stress, in spite of the bureaucratic nightmares sometimes and the hoops they have to jump through. People are really remarkable. Their attitude is, well, it's my mom, or it's my dad, or it's my husband. What else do you expect? Of course I'm going to take care of them. Of course I'm going to give them my all. And they feel frustrated with the system, but they still feel this overwhelming love and affection for the person they're caring for, and that they can't imagine doing it any other way. The idea of them perhaps having to go into a facility at some point may be in the back of their mind, but their attitude is, I'm going to keep him or her home as long as possible. I'm going to be providing the care as long as possible. And this resilience and being able to bounce back day after day, I've met just such remarkable people in this whole journey of writing the story. People that are even traveling around the country in some cases to speak out and to speak up and become advocates for increased awareness about Alzheimer's and the needs of family caregivers. The attitudes are just totally remarkable. There were some instances and certain providers that are really dedicated to helping families and caregivers go through this process. They have a big frustration too, which is that because of the reimbursement system in the U.S., they don't get paid often for counseling or phone consultations. But there are certain providers that have worked around it, for example, by hiring a nurse practitioner to field phone calls from family caregivers, where they're getting the expert advice, even if they're not speaking directly to a clinician. It's a means for the family to pick up the phone, get an answer from a knowledgeable caregiver, and really foster the communication. I think one of the big issues is communication. And when family caregivers can communicate with the clinical side of the process, everybody benefits. Very often they're afraid to pick up the phone. So if they know that there's somebody at the other end that has the time and the expertise to talk them through a difficult situation or a difficult problem, it makes the whole caregiving process run smoother. I think one of the other things that's happening is we're seeing a big move now towards team-based care. And what that involves is physicians and specialists and therapists and social workers all collaborating together so that each one is not working in a clinical silo anymore, but that they're actually collaborating and talking to each other to figure out what's best for the patient, what's best for this person. How can we help him or her live their life to the fullest and provide quality of life? And we're seeing a very slow but steady shift away from this treatment-based approach to a wellness, holistic, quality of life kind of approach. The providers I spoke with are the ones that are primarily at the forefront of this effort, but they're really making some progress, and they're really trying to do what's best for the patient and the family. So they're not necessarily treating the disease as much as providing a better life for the person involved. And that's very encouraging.